if you have symptoms like acid reflux, bloating, gas, you maybe have shortness of breath, heart palpitations, anxiety associated with that, perhaps constipation, trouble swallowing. There are up to 20 different symptoms associated with hiatal hernia syndrome. Now, you might think it's unusual or rare to have this condition. In fact, quite the contrary. It's a very common condition, on average affecting 20% of the population here in the US, but it really is based on age, so that if you're age 50, the percentage of incidence is 50%, 60%. So as you get older, the incidence increases. What's interesting about how the condition is described is that one is told that predominantly people are asymptomatic, so they have no symptoms. And so then you have to then ask the next question of, what are the symptoms associated with hiatal hernia syndrome? And that's where you run into why this is missed so much, because the symptoms are acid reflux or GERD, and that is an extremely common complaint by Americans, and certainly PPIs, proton pump inhibitors, or acid reducing medication is one of the most common medications prescribed. So that's getting into the common arena. So that symptom is associated with hiatal hernia syndrome. But to say that most are asymptomatic and you're only associating it with that symptom, what you are missing, of course, is the shortness of breath and the heart palpitations and the bloat, the gas, the abdominal pain, the constipation, trouble swallowing, dizziness, feeling faint, etc., etc., etc. So I want you to realize for yourself or someone you know and love that these symptoms are not only associated with hiatal hernia syndrome, but hiatal hernia is extremely common. Then we have the additional piece of information that you can have a frank hiatal hernia that is found on an endoscopy, a medical procedure, but 95% of hiatal hernias are sliding, meaning the stomach gets pushed up and then it comes back down again. So if it's a small hiatal hernia, it can absolutely be missed if it happens to be down versus up. Additionally to that, we have the fact that the acid reflux, which is this symptom so associated with hiatal hernia, and it is, but why are people asymptomatic? One reason is that they can't feel it. So 50%, half of all acid reflux, is silent. And that simply means that instead of the acid kind of gushing up the esophagus with a vengeance, and you go, oh, I have heartburn, it's burning, and it's definitely impossible to miss when your body does that sensation. But if it's silent, meaning the acid is just kind of creeping up the esophagus, then you're not complaining of reflux, you're not complaining of burning. Now you might be complaining of a lump in your throat or hoarseness, trouble swallowing. Those are more the symptoms associated with the silent reflux, which is also known as LPR. So I wanted to discuss this because so many people are suffering. They remain undiagnosed, misdiagnosed. The misdiagnosis really concerns me. I met a young man yesterday, a professional singer, and he had been put on steroids for asthma, which, he was put on all the steroids, and he was put on an allergy medication, both for his shortness of breath. Before the tests came back on his lung function and his allergy test came back, and then they came back 100% perfect. And then the doctor's like, okay, stop all that. It's like, okay, great. So put all these chemicals in my system prior to even the test coming back because he was so sure that's what it was when it wasn't. So you have people being misdiagnosed, being put on things that increase their heart rate, decrease their heart rate, lowering blood pressure, being put on inhalers for a lung problem they don't have, being put on anti-anxiety medication. That's a huge one when the problem has nothing to do with their mental state. It's all coming from this problem, which at its heart is a digestive imbalance at its heart, even though it affects the heart and it affects the diaphragm moving and it affects your nervous system, the vagus nerve, also putting you into fight or flight, hence the anxiety. So it's really a combination of events that makes perfect sense when you just understand anatomy. So I am very wedded to helping all of you who are suffering. I read your comments. I'm not able to answer all of them, but I do read them, and they often break my heart because I want to literally help everyone, because I know how miserable this is. I know how it can ruin your life. And we have created our online course that just got released. So that was our method of getting this data and treatment out to those of you who don't live within the United States, those of you outside and inside the United States who had financial constraints, making it not possible for you to do the entire program here with us at the clinic. And we do telemedicine all over the country, but for some the financial constraints are there. So we did the course to handle that. I am trying to make it possible for everyone suffering to get the help they need. So please do give us a thumbs up, subscribe to the channel if you like this information, share this information, because I guarantee you that you know somebody who has this problem. They might not know they have the problem, and that's the other insidious part, is sometimes they've been told, oh, you have a hiatal hernia, but couldn't possibly be causing these symptoms that are really concerning you, which is incorrect. Or they could just continue to be undiagnosed and misdiagnosed and just being given an acid reducing medication and being told, that's fine, take that for as long as you need, which is also false information, because these drugs are very dangerous. And long-term, anything from heart disease to cognitive decline to lack of absorption of certain minerals and vitamins, damaging your kidneys. The list is long, and I have videos about that if you want to get all the specifics. But I just want to end this suffering. It is so treatable. It rarely requires drugs or surgery at all. It's a natural program. We have an 85% success rate. So help me find these individuals who need this message, and please get it out to them, because believe me, you know somebody. And if you want more information, give us a call, and we're here to help.